You are a GP and one of your patients is worried about receiving a troubling diagnosis. What approach would you take to communicate with this individual and address their concerns effectively?
So I think the first thing to ensure is that you're in a private space. So if you're in a waiting room, you might want to take the conversation into a consultation room, just so that you can have an open conversation with the patient and no one feels uncomfortable. Then I think the first thing to do, obviously, is be empathetic and understanding. Let the patient speak and give them really time to talk through their worries, so that you can really understand the root cause of why they're so worried about a troubling diagnosis. Is it a family history, or is it more generalised anxiety or depression? And that really helps you to address the problem if you understand the root cause. As you're speaking, you want to be fostering open body language and good non-verbal cues, nodding and listening to them carefully so that you can understand everything they're saying and are able to best approach the problem. Overall, the key thing here is empathy, understanding, and using non-verbal cues to have an honest conversation that makes the patient feel reassured.
You are working on a school project with your classmates. Two of the team leaders both want to be the social media lead, which causes a difference in opinion and leads to conflict within the team. How do you approach resolving this?
Okay, first off, you want to actively listen to both of the team members. You want to understand why they both want to do the social media lead, what skills they have, and that can maybe inform you in terms of potentially splitting the role into two, and they can each take on parts which lie within their specialty in terms of what they want to do within the team. Obviously, you want to try and prevent conflict. Conflict isn't always bad of a thing, and it can, lead to constructive conversations, but it's really important in this case that you don't want the conflict to be disrupting the team's work. So you want to address the problem quickly and efficiently, and be able to potentially, like I said, split the role into two so that both can carry out part of it, or if there's not scope for that, finding out how both of the members can fit within the team, maybe one of them carrying out the YouTube parts of the social media and one of them taking on the Instagram or TikTok, as well as other responsibilities within the team, so that you can have a cohesive working environment.
You are a medical student observing a surgery and you notice a senior surgeon being dismissive and ignoring members of the nursing staff. What are the potential consequences of this behaviour, and how would you attempt to maintain a positive and professional atmosphere in the operating room?
Okay, so in terms of consequences of behaviour, obviously if the surgeon's being dismissive and ignoring the nursing staff, this could potentially impact on the staff morale, the teamwork within the group if the nursing staff don't feel like they're being listened to and don't feel like they're really part of the team. But potentially more importantly, if the nurse is trying to flag up something to do with patient safety that hasn't been addressed. For example, I know in surgery there's a checklist you have to go through before you begin. If one of those points has been missed off the list and the nurse is trying to flag that up with the surgeon, then it's important that they're listened to so that the concern can be addressed, and that all procedures being followed correctly. So it's ultimately a problem for patient safety as well as a problem for the general environment and the working environment for the staff. In terms of addressing it, as a medical student, it's potentially best to first talk to the nurse about it. Obviously, if you're on a placement, you might not have seen this happen regularly, and you want to understand whether it's a recurring problem, or whether or how it affects the nursing staff, and if it affects them at all. And then if they do flag it up as a concern and do address the problem, then potentially it's worth talking to another doctor, registrar, or another junior doctor about it to see what their thoughts are on it, as they'll obviously have more experience with the working environment generally and understand the different staff members better. So talking to them about it and then allowing them to follow up on it if it's something they do think is concerning. But even if it's not something they do feel is a concern, it's an important learning opportunity for you as a medical student to understand how the working environment works and to understand whether this is a concern and important to notice in the first place.
Communication with the healthcare team is vital in providing coordinated patient care. Describe a time in which you effectively collaborated with other healthcare professionals to achieve a common goal.
So I undertook a work experience in a pharmacy, and as a part of that I was working together with the lead pharmacist to triage patients who came in. So my main responsibility included talking to each patient that came in and understanding what they wanted to get from the pharmacy, whether that was a prescription, whether it was a conversation with the pharmacist, potentially about a rash or another condition they had which needed kind of specialist advice, or whether they were just looking for some vitamins or kind of over-the-counter medications which could just be bought at the other cashier. So triaging those patients increased the efficiency and allowed the pharmacist to then deal with any concerns that were directly, her expertise were directly needed for. And it was a really good learning opportunity because sometimes I'd see a medication, I'd have a look at the ingredients and see active ingredients I hadn't heard of before. And it was really, a kickstarter for a conversation with the pharmacist about what this medication does, which patients it's suitable for and which it isn't suitable for, and why it's so important to consider why different medications, even though they're treating the same condition, can be specifically important for certain patients with other pre-existing conditions. So in conclusion, working together with the pharmacist to triage the patients allowed me to increase my knowledge in terms of understanding medications and drugs generally, but also understanding why it's important to have those triage procedures so that everyone can carry out work efficiently and all patient concerns can be dealt with quickly.
As a doctor, how do you adapt your communication style to an 85-year-old?
So first, going into the conversation, I think it's important to not make any assumptions about the 85-year-old in terms of both cognition and capacity. 85-year-old patients can be widely different across different patient groups, and it's really important to recognise that when having the conversation, so you can have the conversation in a non-judgmental and respectful way. Then in terms of the communication itself, we want to consider both verbal communication and non-verbal communication. So verbal communication, potentially even 85-year-olds hard of hearing, we want to make sure you're speaking loud enough, so you're also clear enough so that they can understand and they're aware of all the information that's being given to them. And also listening to their cues, so understanding what they're saying, and then if they're understanding the information you're feeding back to them, that's really important, and then responding to that accordingly. In terms of non-verbal cues, if we're talking about hearing again, this could be leaning in as well, using your hands or your facial expressions to express understanding, if potentially they're difficult in terms of have lowered capacity in terms of understanding certain verbal cues. So overall, you really want to integrate both these verbal and non-verbal communication styles and go into the conversation again with no assumptions and really understanding that each patient's an individual. But again, simultaneously respecting that different age groups might need different adjustments in terms of communication.
Are there any differences between the expected qualities of a qualified doctor and a medical student?
So I think it's first useful to define what we mean by quality. So quality, we're talking about a personal characteristic that the medical student or doctor has. In terms of similarities, essentially there are many, because you want doctors and medical students to foster the same attitude towards patients and towards a clinical environment. But ultimately, a medical student is still a doctor in training, and their knowledge and skills will not quite be to the same level that a qualified doctor would be expected to have. And that's completely fine. They're obviously still learning, and they're going to adopt many of those skills and lots of that knowledge as they go on through their journey to become a doctor. But in terms of other skills and qualities you might see as differences between medical students and doctors, the balance between emotional sensitivity and resilience to potentially emotionally challenging situations that both a doctor and a medical student will see in a hospital may be different in a medical student, as they've not quite potentially found that balance between the emotional resilience and sensitivity and empathy to problems that they see in the hospital. And they can really develop that balance as they go on before they qualify as a junior doctor. So in conclusion, it's really important to recognise that a junior doctor and a medical student will have many similarities in terms of qualities, but overall medical students are still learning and their knowledge will not quite be to the same level as a junior doctor, and potentially also their understanding of the balance and approach to sensitive and emotionally challenging topics within the hospital.
Doctors encounter patients from diverse backgrounds, including those with language barriers or varied religious beliefs. What steps are you taking to ensure cultural competence and sensitivity towards patients to providing equitable healthcare for all?
So I think in terms of language barriers, it's important to recognise there's loads of different resources that can be used now to address these. So Language Line is a great service that's used within hospitals and medical settings to be able to translate information so that patients can properly understand all the information that's being given to them and all the, for example, treatment options that could be available to them that allows them to make an informed decision about their own healthcare. In terms of cultural differences, it's really important to respect these differences and recognise them because they are differences, but also not let them affect how people are treated within healthcare. What we mean by equitable healthcare is ensuring that everyone gets equal opportunities in terms of access to healthcare resources. There's been loads of progress made in terms of this area, in terms of looking at, for example, dermatology, skin conditions on non-white skin, and this has really been beneficial in allowing these people to access better healthcare and for their conditions to be recognised so that they can then be treated. So overall, in terms of competency in this area, ensuring equitable healthcare, we want to really utilise the resources we've got and develop resources to ensure that these differences don't ultimately affect patient safety and healthcare outcomes that we see in different patient groups.
During a routine GP appointment, a patient admits to struggling with adherence to their medication regimen for chronic arthritis. How would you approach this issue and encourage the patient to comply with their treatment plan?
So first of all, we want to address the condition itself and understand why the patient's taking the medication in the first place. So with chronic arthritis, anti-inflammatory medications can be really helpful in terms of lessening side effects. So we could talk to the patient about what the medication is doing for them. For example, is it for pain relief? And what's their understanding of the condition itself and how the medication then impacts on the condition. Then looking at the medication itself, we want to directly ask the patient what it is about the medication that potentially makes it difficult to take. For example, is it administration? Is it, for example, a plastic capsule that they don't really like swallowing? Is it injected? If not administration, is it reminding them to take it? Is it difficult for them to remember? And then if that is the case, we can talk about potentially ways in which they can be reminded through family or friends or alarms. And those can be really useful tools to ensure they're regularly taking it so that the medication can actually be effective. And then if it's still the case that the patient's uncomfortable with taking the drug, obviously we have to respect that's the patient's decision and they have their own autonomy to decide whether they want to take the drug. But we want to stress the benefits of the drug for their condition and give them an understanding of why it could be beneficial for them to take the drug long term.
Medical professionals often face demanding schedules and emotional challenges. What strategies do you have in place or aim to develop to set appropriate boundaries to maintain your well-being and ensure your ability to provide compassionate care?
First off, you really want to recognise your boundaries as a medical student or as a doctor. You want to understand when you're becoming overwhelmed and not taking on too much so you get to the point where you are overwhelmed and you feel overworked. What's really important is time management, looking at what you do have to do and prioritising tasks, thinking about what needs to be done in the immediate time and then looking at what can be done over a longer term basis. And then with the time you've got left, making sure you integrate hobbies and things you enjoy into this, whether that's sport, any form of exercise or seeing friends. It's really important that you get that time for yourself so that you feel more refreshed when you do go back to your work. If it gets to the point, however, that you do need extra support, it's really important to seek this from whoever you feel is you're most comfortable to get advice from, whether that's another doctor, another medical student, a family or just friend. It's really important to get that advice when you feel you need it so that you can then either act on these feelings you're having and that you can get back to doing what you enjoy and feeling happy in your work.
As a future medical professional, you'll be involved in continuous learning and research. Discuss a current area of medical research you are interested in and a potential research question you are interested in exploring.
So I'm really interested in the science of ageing and why ageing drives many of the diseases we see today increasing in the population. Particularly, we could consider whether ageing should be considered a disease in itself, given that it is a risk factor for so many of these long-term chronic conditions. Looking at it on the more genetic level, a research question that could be proposed is looking at shortening of telomeres, which are the ends of your chromosomes, and how this contributes to the ageing process, as well as particular conditions such as cancers. My initial interest in this was sparked by reading a BBC News article and looking at a TED Talk, which then caused me to research this further for research articles, and now at university, which is something you can follow up on.